everyone. Today I have with me Dr. Kirpa Johar, Director of HariDaan Dental Laser Academy, Bangalore. Today I am going to discuss certain things regarding the online laser dentistry course, which I think is a fascinating endeavor that has started newly because of this pandemic situation. Sir, I welcome you and thank you for joining me in this conversation, sir. Um, Sir, actually, I saw your advertisement in your Facebook page, and I was thinking that I had certain questions in mind when I saw that you are doing this course online. So I thought, why
Sure.
not, just to clarify it from you only, rather than thinking too much about it.
Yeah.
So that would be our discussion today, sir. So first question is
All
basically,
right.
sir, like in this pandemic, everything is happening online. So I would like to know what motivated you basically to start your so well-known course that I also have participated. I'm very lucky to learn from you. What motivated you to actually start this course online? I mean to say, what is your thought behind it?
Yeah. First of all, thank you, Dr. Gargi, for organizing this interview, and thanks for having me. Regarding laser dentistry, yes, we have been in fact thinking of starting online courses from very long.
Okay.
Very long means a year or two before this pandemic happened. But
Mm-hmm.
being busy with our regular laser courses, which run regularly, and also with my practice, I never had the willpower to change. Maybe Corona came in a way to redo that. Of course, our physical courses also courses is we can reach out to a large number of people. We have we have already for our regular laser dentistry courses, which are conducted only in Bangalore, India. We have got participants from every country in the globe and every city in India. Probably we have been blessed enough by the dental community who come seeking knowledge for laser dentistry to us, and we are grateful to them for that. So we have got dentists from Australia, from to Afghanistan, to America, to UK, to Middle East countries, Southeast Asian countries, and of course in India. What we have noticed is a lot of participants want to come, even in India and also abroad, but sometimes they can't leave their practice. Then one thing is they can't leave the practice, then the other things that the fees, the travel and the stay, everything adds on. And sometimes they have other obligations, children, small children at home, or any other responsibilities, aged parents. So, and that makes it difficult, but they're eager to learn. We have come across people who have been inquiring from 2 years but haven't been able to make it due to various personal issues. So I think it's a wonderful opportunity that this new age technology is giving us. I did not even know about Zoom or Geo chat before all this happened. But with the kind of technology available, it's so easy to learn from your own home. And I think that is what we are trying to do. And at the convenience of your own home. And we have at the convenience of your home is one thing, and also without disturbing your routine, you can
Right.
continue your practice, you can continue the daily activities. Our courses are for 7 days, 2 hours daily. That also we have kept in the afternoon times between practice, and so we have kept it from 3 to 5 in the afternoons. And the for in it will be 9:30 a.m. in UTC time, which is also a very convenient time. So keeping convenience in mind, keeping reach in mind, I think this is the way to go forward. Those who are interested in coming down, of course, that they are most welcome, and that's never going to stop. Yes.
I think that possibly those many practical reasons are something which has to be considered when we really want to try out something new and learn something new, and traveling is also sometimes not possible. But sir, I was thinking that if you can tell me that how exactly you will conduct this online course. I mean, what would be the mode of delivery? So I would be interested to know that.
We are conducting our courses on Zoom. So basically, what we have done is our course is divided into 7 days. In the 7 days, we discuss different clinical topics, right from lasers in perio to lasers in endo to to aesthetic dentistry to cavity cutting, oral medicine, you name it. Every clinical topics that are possible with lasers, orofacial pain managements, any topic, all the topics are distributed over 7 days, and the course is designed in such a way that it's very clinically oriented, and basically whatever can be done in a practice by a clinician is what is covered. How we do it is we cover what all procedures can be done, how to do them, how to set our laser accordingly. We demonstrate while teaching also with the laser. We have pre-recorded cases which we discuss what we have done, how we do it, and basically what all can be done and how it can be done, and also what all you need to know in terms of your basics in terms of managing your laser, and also in integrating lasers into your practice. End of the day, if you own a practice, most of the dentists do general practice, and even if they are a specialist and consultants, they can further learn more about their specialty. So basically, it's very clinically oriented. We give them all the basics. We show them how it's done, and once you start doing it in your practice, you will start to build up. If you have any doubts, once you start, we are available. I am available for consultation, and we can I can guide you all as to where you need help. We are more than willing to help. We can fix up a time for the participants who have gone through our course and guide them if they are stuck with any situation clinically. But I'm quite confident the way the course is designed around clinical situations, they wouldn't need much guidance. But even if they do, we are always there.
Yeah, sir, that I am also very confident, because I think after learning from you, is just that we buy one laser and start doing it. That is my own experience. I can definitely vouch on that. And sir, like I was thinking, since I was your student and I learned it like in your physical classes. So there you have given the entire exposure. We have, seen each machine, and we have touched it, and we have actually used it in on patients also. So since it is a clinical course, so my I was thinking that through this online course, how a participant would get that, that real feel of holding the instrument, or maybe how realistic would be through the online course. Maybe I can just put my question like that.
Yes, so like I just mentioned, we show clinical cases of different procedures that can be done with lasers in routine dental practice and in different specialities, which can be integrated by the participants on completion of the course. So what we do is we show before and after photos. We discuss how this has to be done. Side by side, we have another camera focused on the laser machine which will be lying on my side. I will show them the settings on the laser. I will show them the photographs. I'll show them the techniques, how it has to be done. It might not be 100% same as a physical training, but there are a lot of advantages which are there in a online training which we discussed initially in terms of logistics. And once the basics are clear, once you know what all can be done, once you know how to do them, once you start using the laser in your practice, I think that should be more than sufficient to start growing in your laser dentistry practice and integrating it successfully in your practice. It would be more than sufficient once you have a sound foundation and you know what all can be done and how to do it. You should be able to use it in all specialities across dentistry with a lot of confidence. And whether it's physical training or online training, once you really start using the machine in your own practice, that is when you will realize, okay, I need some help here and there, and for that we are available. So there's lots that is possible through technology, like I mentioned, through demonstrations, videos, photographs, and I think we can utilize this and try our best to deliver a message of how to integrate lasers in a practice or in a college for a doctor or in his consultation specialty services.
Thank you, sir. And I think my next question, the answer I know, but for the viewers, I would like you to tell. So, because I know that what it means to learn from you, and what exactly how we can actually start from the next day after we do the course. But still, I would like to ask you that. What would be how can you explain, or what are the three most important USPs of your course? So I would like to know that.
Yes. So, what would be the three USPs? I think the first thing, whether it's physical training or online training, the first thing that I would say, it's a very clinically oriented course. It's designed for clinicians basically. It's designed, it can be used by a fresher, it can be utilized by a person who's even 30 years in practice. We have got participants who've been more than 30 years in practice also. It's a completely clinically oriented course. I think that's one of our first USPs, whether it's in physical format or in online. It doesn't go too much in theory. Of course, the basics have to be sound, that is covered, but it revolves more around clinical dentistry, clinical laser dentistry, and I think that's our first USP. Second thing, which I feel is very important, is Haridan Academy is run individually by me. We are not a company sponsored course, and that is sometimes harder than it is in reality, because most of the courses available today are company sponsored. It would be easier if it was company sponsored to reach out to people, but I don't want to, yeah. So I don't want to force or sell any brand or anything. Of course, in the end, they have to use a machine, but we have borne the expenses of the participants and all the logistics involved in the training, just to see that no economical, no commerce is forcing any participant to buy anything. And I think that is a very big USP, because it's in a world where it's completely commercial driven. We have always consciously tried to focus on education and let our participants decide what would be the best laser for their practice. We guide them if based on their practice. Of course, we guide them what they would like to buy, but it's ultimately their choice. We are not pushing any machine, nor are we telling them that this is better. And so the advantage of that is they get a wider perspective of the science of laser dentistry, and are not limited in, or they don't get stuck with one particular brand, or their education is not limited, so that they can know the advantages and disadvantages of different systems and choose accordingly based on what they want. So I would say that is the second one. The third, I think, is me being a full-fledged clinician myself. Uh, it's my own 15 years of experience in laser dentistry which I bring to this course, because if you're not practicing it yourself, it always doesn't have that clinical expertise which is needed in a training. So what I share is coming from my own experiences of handling a wide variety of patients with laser dentistry, and I think being a clinician and training through my own experience does add value to the people learning. So I think these are the three USPs of Haridan Academy to my.
think I agree to all the things that you say, because I think first of all the USP that you said about that it is not company sponsored, and I think that that is most important. And I still remember that you give the pointers like which is bad, and I mean what are the advantages and disadvantages, and particularly how uh, as a clinician or as a new entry into the world of dental lasers, what are the points that we should consider before buying from a particular vendor? And I think I still remember that, and I still have your notes. So I think you said the correct thing. And I feel that, as you rightly said, like as a participant, it's important that when we are learning a thing for the first time, let our focus not be converged, but we get a wider, on diverged view, so that in decision making it is good. Otherwise, we buy something just because of the sake of the brand, and then after some time we don't like it. Then I really think that that's not a good idea. So I think, sir, that's really nice. And, sir, I would also like to know that is there any other additional benefit that a participant gets would get from by attending your online course? Particularly, I am focusing on that in today's discussion. So, can you please highlight something on that?
So, see, the benefit of the online course is integrating lasers into your practice. As we know, dentistry has gone through a very bad phase in this pandemic. Dentists have had their are still facing issues with little support from organizations, authorities. We have been brave enough to face it on our own, and hats off to all of us for that. So I think it's time that those who haven't upgraded and joined the bandwagon of laser dentistry, it's a golden opportunity in the comfort of your own home, because it's time for change. Lasers make dentistry easier. There's less aerosol production. There is need for painless dentistry. There is demand for painless dentistry. Uh, there is there is better earning for the dentist. There's better satisfaction for the patients, and dentists can do all this by learning laser dentistry the right way. And our online courses can deliver that kind of training, which will enable or and empower the dentists to achieve this. So I think it's a win-win for the dentist and for the growth of their professional dental career. Yeah.
Okay, thank you, sir. And I think that is fantastically said by you, as always. And I feel that you have correctly said that it is very much needed to upgrade. And as you mentioned, that if we start incorporating lasers, at least if not the higher end lasers like hard tissue lasers, but still I remember that even a practice in a small town can grow very fast, and the patient compliance I have seen, the patient compliance is very very good. And another thing to all the viewers, I would like to tell that even sir will guide you that how you can charge your patients depending on the area where you are practicing, because that is very important. And it really works like miracle, and you can increase your patient base within few months, because particularly I will talk about small town practices, because there people believe more on word of mouth rather than advertisements. So it just it's like a chain, it goes on. And sir, lastly, I am very interested to know, though I know that I think today we have many courses, many people into the hub of dental lasers, and people are teaching, but I know that you are the person who actually started this revolution to change the face of dentistry and bring dental lasers in the here in the country. So, sir, can you just share a few words about the fascinating journey of your academy? And I mean, it will just inspire all of us.
Said, Dr. Gargi, before I do that, I would just like to add to the previous point. So you said that small time practices where they don't want to buy an erbium laser and a diode is. So I want to come into that and also mention. I have seen a lot of. It's coming back to the previous topic of our courses not are being independent of any brands, not being sponsored. So I think a diode laser, especially in an Indian scenario, is can do a lot. And whether it's a high-end practice or a basic practice, we all cater to human beings, and everybody is doing the best they can from wherever they are coming from. So a diode is more than sufficient, and that is what I always tell the participants. I'm not saying erbiums are not needed. They are, they have a place, but you cannot do without a diode, but you can do without an erbium. And only buy an erbium if it financially works out for you, Otherwise, there is no need to even buy one. And even diodes, there are good diodes available nowadays. There are good Indian diodes available nowadays. So it's very good for. It's becoming more and more mainstream, and a good diode can be the workhorse of your clinic, and it can be on every day in your practice because the variety of work it can do, from endos to perio, to minor surgical procedures, gingivectomies, crown lengthening, gummy smile correction, depigmentation, teeth whitening. I don't see a reason why it should not be on in your practice every single day. So, no matter what the practice is, a diode is more than sufficient because erbiums are very highly priced for the Indian market. We need to understand that, and I can openly and freely tell that because I have no company who's paying me to deliver on trying to sell that machine to them. So they might be upset with what I say, but I'm being very frank and open that it's more than sufficient. If you can afford it without pressurizing yourself in trying to buy it, it's fine. See, I am fully into this, and it's been a long journey. So for me, it works out because my whole practice revolves around lasers. But for a person who's into routine practice, you don't need so much. You just need a basic diode, and you're good to go. And like you mentioned, the revenue generation from one diode is excellent. The patient satisfaction is excellent. The word of mouth of the patients who have undergone a treatment with less pain. So it's a all in all win-win situation for everybody. So that's one thing I wanted to bring about. Yeah, coming to the next question about how my journey has been. Uh, I started training in 2012. So, and I started practicing with lasers, I think in 2007. So it has been a wonderful journey. So when I started the Laser Academy in 2008, I never knew it's going to grow to the level it is today. I just started it small time with one or two dentists. And I think another USP about our training is we don't have a wide range of marketing. We don't, like I said, we're not been company sponsored. It's so what makes HariDaan Academy run is word of mouth. It's dentists who have trained through us and tell further doctors or people who've heard of us. And I think that is our biggest strength, is that it is doctors who are telling doctors, and we are very grateful. I'm very grateful to the dental fraternity for understanding our efforts in providing quality laser education. It has been an excellent growth. We have an alumni of more than 100 dentists now, and I'm connected to all of them, and I'm seeing them grow in their practice. It gives me immense satisfaction, and of course it's not only a monetary thing for me. It gives me satisfaction to see them grow, and see our Haridhan Academy and Haridhan family grow. And it's been an excellent journey, and I'm grateful to God, and I'm grateful to the entire dental fraternity in India and across the globe for being with us and standing with us and being a part of our journey. And we hope to continue to strive to provide quality laser dentistry education in online and physical formats. Yes. Dr. Gargi, I want to add one more thing is, of course, Haridhan Academy has grown, but one more thing which has grown is laser dentistry in India. So, and that's why I wanted to bring that out also. When I started laser dentistry, we had one supplier for the whole country. We had one diode laser. Today we have 15. Today we have 15 lasers available. Awareness is there. I'm happy to see PG students getting thesis topics on lasers. They routinely come to my clinic for their thesis topics. Or colleges, perio departments, of course, other departments also taking up these topics on laser dentistry. Uh, Professors coming for training, sending their PG students, awareness is there, growth is there, and I think that's a very, very positive sign. And I would say, and I've said this earlier also, I think in the next 20 years, we would have a diode laser in every clinic in India. It's like how we had probably X-ray machine in the olden generation. I said that in my class also. And we used to have boards earlier with dental X-ray facility.
Right,
And
sir.
today, if you don't have an X-ray, it's understood you have to have an X-ray. So it's only going to grow further because what is good, what is market driven, and what the patient wants, that can't be stopped because nobody wants to go through pain. And I think laser dentistry has a very large role in simplifying dentistry and making it more comfortable for the patient. So when the end consumer requires something, nothing can stop its growth. So that's one thing I wanted to add on laser dentistry's growth too.
Thank you, sir, for all the insights, and it was fantastic talking to you. Thank
Yeah.
you so much.
Thank you, Dr. Kargi. Thank you. Thanks.
Thank you so much, sir. And I think you have answered all my questions. And I think after hearing our conversation, there is no scope of any more questions regarding your course. And as I already told that I was a participant and I was your student, so I know the value. So I request everybody to take this opportunity. And since sir has started online classes, that is a boon, I can tell, because in our time we didn't have that facility of online classes, so we had to travel all the way. But then I think this is the very good time, and we can utilize to upgrade ourselves. And dental lasers in India, the one name that comes, at least in my mind, is Dr. Kirpa Johar. So I think this is the best opportunity we can all use. And thank you so much, sir, for coming here and clarifying all my doubts. Thank you so much.